on the hoof. At least I don't know of any that do. But as I say, I'm probably not the expert on that one. Is there a limit to how many breast surgeries you can have in your lifetime? I had a BBA age 40. Then at age 54, had implants removed with mastopexy and new implants. No, that's nothing. Not at all. Not at all. But having said that, you need to reduce the amount of surgeries you have to your breast. And I always say to people, minimize the amount of operations you have to your breast, because every time you have an operation, you're creating scar tissue. And scar tissue can cause the capsular contracture, the hardening of the implant. And particularly if you're having surgery for capsular contracture, when someone comes with a bit of capsular contracture, I always say to them, leave it as long as you can, because you don't want to keep on changing your implants every few years, because you're creating more scar tissue every time. So you really need to limit it as much as possible. So you need to not have as many, you need to have as few operations as you can to your breast, but there's no limit to the amount of operations you can have to your breast. So two ways of looking at it. But so yeah, there's absolutely no limit to it, but I wouldn't advise you to have too many operations to your breast, because every single time you're creating more scar tissue. So and particularly if you're doing things like doing capsulectomies, removing implants and things, because you're going to remove a little bit of breast tissue, try as you might not to, every time you do that surgery. And so, that means less breast tissue to cover the new implants. So more risk of visible rippling and feeling the edges and things. Trying to avoid